This Guy's Garage. Like and subscribe.
Now, the impact of the pandemic on vaccination coverage has yet to be assessed. We're under the impression that issues surrounding the efficacy and safety of COVID-19 vaccines probably blunted the confidence of some parents in vaccines that have been in use for decades. So the trust needs to be rebuilt.
Dr. Kitchen, please, for 5 minutes.
Thank you, Mr. Chair, and I'm so impressed with the panel that we have here today. It's just amazing. Your answers are so succinct and so clear and much appreciative to the committee. And for us in doing a study on children's health, where do you begin? I mean, there's so many avenues to touch on that, and how do we do that? So hopefully I can get a couple of questions in here. Anyway, Dr. Quach, and thank you for your work with HESA and when you presented to the committee in the past. We really do appreciate that. And over the years since COVID started, there have been a lot of things. And today you sort of touched on one thing that's of interest to me. Is in reality, you sort of mentioned about polio being back in the U.S. for the first time. And, you know, I've been to Islamabad, Pakistan, to the polio center there, and the great work that they're doing, the great work that all Rotarians do in Canada in helping to fund some of that programming to deal with the vaccinations with polio. You know, we have measles we're seeing parents that are not having their children vaccinated with measles. You know, we're seeing tuberculosis back in Canada. And that's something that a lot of Canadians don't even understand. In my hometown of Estevan, we had tuberculosis in the southeast corner of Saskatchewan. Most people think also just in the north, so we don't have to think about it. So it's there, and we need to be touching on these things. And the concern we have is that when COVID came, unfortunately, it was such a scramble at a time that we got so much misinformation, and there were so many poor decisions or decisions that were made in haste that were then retracted, et cetera, that made it for example, the Public Health Agency of Canada were coming up with certain points and then changing those points. And so my question to you, Dr. Quach, is what do you see that we can do? How do we rebuild that trust? What would be one of the first steps we need to do to rebuild that trust with Canadians? Because they need to see that trust so that they can start recognizing the great value of vaccinations.
I mean, that's the million-dollar question. If I had the answer, I'd give it to you. I think the first thing is for people to understand what decisions were made based on science and what decisions were made that were political. And I don't know how easy that is. I don't know how to rebuild except to start discussing and talking and being able to say that there are some things that we don't know, but other things on which, you know, we have good evidence for. I think that one thing that is not about trust, but is the storytelling. So as you said, you've seen polio cases, but most of us have not. Grandparents who used to go to pool in the summer and not come back in the fall to school are not there anymore. So how do we ensure that parents understand that we have the data to prove that vaccines are safe, but that on top of that is that they are a great help to our health, and in fact they save our health. I think that with the pandemic, we are seeing more and more meningitis and other bacterial cases. Some of them are vaccine preventable, some are not, but it's just, you know, understanding that we still face infectious diseases. You were saying measles is back, syphilis is back. We're seeing congenital syphilis cases that we weren't seeing before, and that's not a vaccine preventable disease, but it's just a matter of understanding that these diseases are back, and if we don't maintain a good vaccination coverage, they will be back and will have deadly consequences. But I don't know where to start to rebuild trust except to discuss and have the frontline doctors, nurses discuss with their patients and make sure that those who are in contact with parents are able to have all the knowledge they need to have that conversation. So ensure that in medical school, in nursing schools, that we do have those conversations and those classes to make sure that people feel well-tooled, or outillés, I'd say in French, to be able to answer those questions that parents will have. Because in the end, those people that we listen to most, we as in parents, are the people that take care of our children. So I trust my physician. My doctor said, "Did you read about this and that for your child?" And I said, "No, I trust you. If you tell me that my child needs whatever medication, I will trust you. So trust starts there with our healthcare workers.
Thank you, and I appreciate that, and I appreciate your comments on recognizing that there is a difference, that certain diseases are of value with vaccines and certain ones are not, and basically we're dealing with antibiotics, that we need to deal with certain things, and you touched on that a little bit earlier.